All right, let's get back to our local medical experts. I'm joined today by Dr. Nairi Thorne with Wake Forest Baptist Health, Dr. Jamila Speaks with Novant Health, and Dr. Alvin Powell with Cone Health. Most of the calls that come into our newsroom are about vaccine appointments. So let's talk about that. Lots of frustration there. Dr. Speaks, how do the hospitals get doses? Is it assigned? Do you request how many? How does it work?
Sure. So our hospital gets a baseline amount every week that comes from the state, and that amount is determined by the state. We also get enough vaccine to provide a second dose to people who were previously vaccinated weeks before. And when we do have special events for mass vaccination or pop-up sites, we can request additional supplies if they're available for vaccines.
Okay, so it comes from the state. It's not like they're releasing however many, they're getting it from another spot. All right, so Dr. Thorne, every time new slots open for appointments, we get calls about just how fast they go. What seems to be the problem with that?
So there is a lot of enthusiasm for receiving the COVID-19, and that's great. However, the demand outmatches the supply. So what we need to do is to pool our resources together, major medical health systems and other organizations, to increase the ability to provide doses to large numbers of people. Perhaps pooling staff and other kind of resources will allow us to do this. Even offering weekend and evening appointments may be options in the future on a regular basis in order to provide a solution to this very big problem.
But as you said, there is much more demand than there is supply, and so that's really the main issue there. So Dr. Powell, there is some concern that as the next phases open up, the groups will then include people who are younger, more tech savvy. They're the ones who are going to get the appointments instead. Does your hospital have a plan to ensure people 65 and up are still going to be able to get vaccinated?
Right, we still have access by the website for people to get vaccinated, and we are trying to be more intentional about reaching out to people, particularly people of color, with respect to their being able to get the vaccine. So we are intentionally reaching out to these populations of color and trying to reserve a certain percentage of the vaccine for this population.
Okay, so Dr. Speaks, can you kind of talk about the selection of the vaccine? So a lot of folks say, hey, when I go to get my vaccination and I make my appointment, can I choose Pfizer or Moderna?
As we've all discussed, the supply is limited and outpacing the demand. So for that reason, selecting which company vaccine you want is not a possibility at this time. And that's because we have to use what we have available to us.
Mm-hmm. And Dr. Speaks, following that up, when do people make their appointment for that second vaccine?
So that will be taken care of when you get your first vaccine. So on your way out for most of our vaccine sites, there will be someone to help you get that scheduled.
Okay, so you're not going to leave dose number 1 without knowing when you're getting dose number 2 and where you're getting dose number 2. So, Dr. Thorne, we're now in phase 3. What is your hospital system doing to be ready to handle even more calls and people who want to sign up?
So we are using various techniques in order to make sure that appointments get filled. We certainly do not want to leave out our 65 and olders who may be less tech savvy. So we are going to call them in order to fill appointments. We are also going to use other organizations to make sure that those that are 65 and older continue to get vaccinated, such as partnering with senior subsidized housing and even incorporating Meals on Wheels, in addition to making sure that our other groups continue to have appointment availability.
Okay. And Dr. Powell, let's talk a little bit about this because people have asked this question many times about NSAIDs, allergy meds, and the vaccine. How do all those things work together? Are they safe? What goes into all of that?
Yeah, as far as NSAIDs are concerned, one of the things we want to do is make sure that we do not take NSAIDs before or immediately after you receive the vaccine. We want to be careful because it may blunt the immune response. Anti-inflammatories will potentially blunt the response. We won't get the maximum effect of the vaccine, so we don't want to do that. As far as taking antihistamines, we don't want to take those prior to getting the vaccine, because there is a possibility, a very small possibility, that people can have an allergic reaction from the vaccine. That antihistamine might suppress the initial response. Their reaction might occur later. So everyone who gets a vaccine, they have to stick around anywhere from 15 to 30 minutes. That's when a reaction, if it's going to occur, will occur. So don't take antihistamines. Try not to take NSAIDs if possible as well.
All right, and just in case NSAID, you're like, what is that? That's your Tylenol, that's your ibuprofen, that's your Aleve.
That's your, exactly. It's not your Tylenol, but it's your Aleve, your ibuprofen, your naproxen, those kinds of medications.
Wanted to make sure everybody knew what that was. Okay, so Dr. Speaks, once people make their appointment, what can they expect then when they arrive at the location?
So we screen everybody for COVID-19 symptoms. Depending on the location, for example, if you're at one of our mass vaccination sites at Kings Mall, you'll be escorted through the process, and the person who's providing the vaccine will give you safety information. As Dr. Powell mentioned, we do ask for you to wait in a waiting area for 15 to 30 minutes after receiving the vaccine, and during that time, a scheduler will get you scheduled for your second dose.
All right, so following that up, Dr. Thorne, after your second dose of the vaccine, again, we're talking about the second dose here, you're not walking out immune. So should vaccinated people quarantine if they get exposed to someone who is COVID positive? Should they still wear a mask? What do they need to know to do?
That is a very good question. Because you are vaccinated does not mean that you should not continue to follow all of the preventative measures that are in place. We still need to wear a mask. We still need to wait 6 feet apart, and we still need to wash our hands. We need to use all of these tools in our toolbox in order to keep both ourselves and our communities safe from this pandemic. If you are exposed to a person who has active COVID vaccination, or who is actively exposed to COVID, and you've been vaccinated, you do not necessarily need to be quarantined if it has been at least 2 weeks out from your second dose of your vaccination. So for the Pfizer, it's 3 weeks, and for the Moderna, it's about 4 weeks. So if you've received your second dose and it's been at least 2 weeks after that, you do not need to quarantine if it's been within 3 months and you do not have symptoms.
Okay, good to know. And Dr. Speaks, let's talk about women who have been vaccinated needing to wait to get their mammogram.
Right, that's a great point, Tanya. We prefer, if possible, that you get your mammogram before your first dose, or waiting for 4 to 6 weeks after the second dose. And that's just because this vaccine, like other vaccines, create an immune response. We have lymph nodes in the area underneath our arm, and that's part of our mammogram evaluation. So we just want to avoid any additional procedures that may be sparked by seeing an inflamed lymph node at the mammogram. If you do have a need for a diagnostic or a special type of mammogram, we still want you to get that on time. This only applies for screening mammograms only.
Okay, and that is just because the swollen lymph nodes then make it appear as if there could be breast cancer. It gives kind of a false positive.
Right, it would just be a finding that would need to be followed up. And we would want to avoid any unnecessary tests, since that's a probably very common reaction after a vaccine.
Okay, so we're going to be able to ask your viewer questions in just a moment, folks.